Great.
Wonderful. You got that good to go?
Yep. And I'm going to go ahead and share my screen here in just a second.
Perfect. All right. Thank you very much, Rachel. All right. Well, I want to first thank everyone for joining us today. We are excited to have you join us for the bin billing your vaccines through DocStation here with us today. My name is Amelia White. I am a customer success manager here at DocStation. So whether you're joining us live or catching us through the recording, we're glad to have you part of the DocStation community and looking forward to helping you increase your revenue by utilizing DocStation. Today on our webinar, we're going to have DocStation's wonderful head of pharmacy success, Rachel Betts. As she mentioned, most of y'all have spoken with her, if not worked one-on-one with her. She is fabulous. And then we also have Lauren Saavedra. She is the Director of Business Development at ReNue Apothecary, located in Texas. Wonderful client of ours. We are glad to have her join us and share her expertise using DocStation through bin billing. So as Rachel mentioned, we encourage you to pop any questions you have in the Q&A feature located at the bottom of your Zoom link. We'll try to answer as many questions as possible, but we will also have a Q&A session at the end of the webinar. So let's go ahead and jump right into it. I will pass it back on to Rachel.
Thanks, Malia. Appreciate the intro there. All right, guys. So my goal here for today is to make sure to go through a couple of things with you. What sets DocStation apart? Why are we, what makes us different? What makes us unique about billing through DocStation for your vaccines, Med B, or otherwise straight to DocStation's bin? We're going to go through a little bit about what makes us different and unique there. And then we're also going to take some time talking about why tracking your claims is so important. So obviously everybody on this call here today knows that reconciliation is a big part of, any sort of medical claims. And we want to make sure that you understand tracking claims at DocStation is just as important to us as it is to you. So we're going to talk a little bit more about why that's so important and how DocStation does that for you. We're also going to talk more about the types of vaccines that you can bill to Med B. If you're new to this, things like that. We're also going to talk a little bit more about billing those same vaccines perhaps to a Medicare Advantage plan or a commercial payer that allows you to bill on a medical benefit as well. And then for those of you that are unfamiliar with DocStation's bin billing process, I am going to walk you through briefly about how that setup process works through us. And then I'm also going to, we do have Lauren Saavedra on with us today. I am going to ask Lauren to take a little bit of time to talk about her experience. So you're going to hear from Lauren from ReNue and go through a couple of things about what she's learned over the last year working with DocStation and what sets us apart a little bit. We will have some time to close out the session today. I will talk a little bit more about some additional services that are available on DocStation. Again, today's main purpose is talking about vaccine billing using DocStation's bin, but I do want to make sure that I highlight a couple of additional features that we do have. And then we'll also have some time for Q&A there as well. All right. And I do apologize, guys. For those of you that are familiar with me, you know that I have multiple screens. So if you see me looking back and forth between different screens, that's why. And again, we are going to provide a copy of this session in addition to these slides. So you'll have a PDF version of these slides to go back and review as well. So you do have the option to take a look at that later. I know some of this print is a little bit small, maybe on the screen that you're viewing, so you can go back and view this later on. So I did mention I want to talk a little bit about DocStation's features, why we're different, what sets us apart. Looking at DocStation's platform, the RCM suite is something that I think you'll find is quite different from what you're used to. Meaning, I've talked about the importance of tracking your claims. I want you, and I want any of our client that bills medical claims through DocStation to not have to go back and forth between different platforms to see what you got paid, when you got paid, how much you got paid. Our RCM suite allows you to download reports that will let you see all of those details. They'll let you see the check number, the check date, how much you got paid on that particular check. If there's an RX number tied to that particular claim for that patient, you can also use those tools to reconcile in your own systems. So when looking at DocStation's RCM features, we have incorporated quite a bit. I'm just showing you quick snapshots of a platform here across the top of the screen. Of course, these are all fake and made up patients, so please don't think these are real patients here. But we do have quite a bit of features available to download as a report for you for any reconciliation purposes. This also allows you to build your own work queues. So again, for those of you that are semi-familiar with DocStation, you've seen some filter tools up at the top. These are extremely important when you are working through your queues with DocStation. You want to be able to just single out claims that are denied that you need to understand why they were denied. Claims that have come back as rejected or invalid claims that need to be worked. So you can use our filter tools. You can use these options to be able to build yourself a queue and manage that queue effectively, again, all in the same platform. It is important to make sure that you understand you don't have to navigate back and forth, and you can see everything on the DocStation claims dashboard for you. Looking at claims tracking, so it is important to mention, we're going to talk about ERAs here in just a second as well, but the way that DocStation can give this information back to you as the user is we do grab those ERAs for your particular payers. You will see any status reported back from those payers. So you will see, I can demonstrate a little bit right here, but you will see any claims that are in a submitted status, meaning they have gone to the payer. You'll see claims that are in a paid status. You'll see claims that come back as denied. And most importantly, you will see why. So you will understand more about your claims. I think that the feedback that I've gotten from a lot of our clients is they don't understand what's happening with their claims. And a lot of that is missing. That's kind of that missing piece of the puzzle. To really understand what's happening with your claims, if they're being denied, why are they being denied? Are they stuck somewhere? Have you not seen the status update for a particular claim? Meaning you have to go track down the status of that claim. That is not something that DocStation wants you to have to do. We want to be able to grab those ERAs and be able to post the status of those claims for you so that you can see and you have the visibility and the transparency with your claims. The way that that transparency works, so any claim that you submit on DocStation, I'm showing a little bit of a snapshot here of the history of a particular claim. So you can see here any sort of claim that has been updated, you will be able to see the history section of that claim. Was it received by the payer? Was it marked paid from the payer? And you'll see when. And then, of course, that will reflect as a paid claim on your dashboard. You'll also be able to see any clearinghouse reports, so any status coming back from the clearinghouse. And if we need to, DocStation can actually help dissect what that information means. So there's a lot of additional details that are, again, a missing piece of the puzzle currently for a lot of folks where they just don't have that visibility and they don't have that transparency. And that's what DocStation can offer when you go through DocStation for bin billing with your medical claims. And I do have to brag about our customer support for a little bit. Of course, I'm part of that team, but Malia and Zoe and Thirthy, and I'm sure you've heard some Aubrey. I'm sure you've heard some other names pop up and from our support team. But when you reach out to DocStation, whether that's via email, whether that's through our support chat, whether that is directly through our secure messaging center, the response back is from a human. We will dig into your claim for you. We will call a payer if necessary. We'll help triage that claim. You do have another human on the end of the line, right? So you will be communicating directly. When you see a face on that chat support through intercom, that face is the person you're talking to. That is me. That is Malia. That is a Zoe. So all of our customer support, I do have to take a second and brag on us for a little bit. I do think that we are outstanding in our customer support here. And again, like I mentioned, we will help you with triaging your claims. We try to post as much, and I say we, DocStation tries to post as much information back from your payer as possible so that it is easy for you to understand what's going on with your claims. But if there's something that you can't understand, if you see a reason in the history section that is confusing, you don't understand what the response back from the payer is, ask us. Please let us know. We're here to help you and help understand what's going on with your claims to help triage that. And then, of course, down here at the bottom, we do want to grab those ERAs. And this is a good segue into our next session here, our next section. But we want to help you get those electronic remittances. So we do walk you through that process. If there is a signature required, of course, our enrollments team will help you walk through that process. If you need to jump on the phone with an enrollment specialist because it's a confusing process with that particular payer, we'll absolutely do that with you. So there is a lot here with our customer support team that is world-class in my particular opinion, but we are here to help you because it's just as important to us as it is for you guys to make sure that your claims are processed correctly. So with that, I know there's a lot on this screen and it's okay. So we're going to give you a copy of this, but I did want to take a few minutes and talk about why ERAs are important. So if ERAs are foreign to you, or if it's not a concept that you're familiar with, allow me a couple of minutes to go through this with you. And ERAs are electronic remittance advices. So if you're familiar with getting an EOB, an explanation of benefits, it is a little bit more detail that comes in electronically from that payer. So what we want to do is be able to have access to that explanation from the payer directly. So it'll tell us whether the claim was paid, what codes were behind it. If a claim was denied, it'll tell us why that claim was denied. And of course, again, the big difference is we want to push all of that information back to you as the user so that, again, you have transparency about what's going on with your claims. So how do we do this? We request an ERA submission from you as the user. You let us know which payers you would like to submit to. And so we want that claim to be submitted through DocStation. We will grab an electronic remittance advice from that payer so that way all of those claims and all of the data that's behind those claims are then directed back to DocStation. So when you have a claim that's submitted through DocStation, I'm going to go take a few minutes kind of explaining how this process works because it is a little different if you're unfamiliar with it. But I do want to take a few minutes and explain kind of how this process works for you. You submit a claim through DocStation. And the first kind of step here when you submit a claim through DocStation is we do have validation and error checks, things like that, to make sure that the information on the claim is valid. So once that claim goes through and is submitted on DocStation, it does go through to the clearinghouse, who then forwards it on to the respective payer. At that point, the payer will then see that claim and also see to make sure that those claims are valid. If anything at that point comes back from the payer to say that that claim is invalid, or the gender, it does not match with that patient, or you know what, it looks like they actually lost coverage. At that point, that will then be displayed back to you as the user to let you know this claim is not a processable claim, meaning it can't be adjudicated by the payer for whatever particular reason. But again, the big difference is that you now know what's going on with that claim. So if that claim is successful and it does go through and is processed by the payer, once that claim status is adjudicated, now that we have those ERAs, that claim status is sent back to the clearinghouse. And because we use two different clearinghouses, we use Availity and Change Healthcare. Depending on your preference, we can use either. And of course, we know that a lot of places had to make a big pivot in February, March, and April, with Change Healthcare being the largest clearinghouse that went down. So DocStation made that pivot and made available a new clearinghouse. So we use both Availity and Change Healthcare now that Change is back online. But that status is sent back to the clearinghouse. And then, of course, because we have that ERA, we will then be able to obtain what the insurance has paid out on the claim. We'll be able to understand if there is any patient responsibility, what the patient owes back to you as the provider. We'll be able to determine any denial codes, or if that claim was paid, maybe it was paid partially. We'll be able to understand everything back from that payer. And again, we post that back to you as the user. So we receive that ERA as well, and then update your claim directly on that dashboard for you. So again, there is no need to go back and forth between portals as long as we have that authorized ERA. So again, I know that's a lot of information on this page. It is not something I expect you to have to read through everything on this page. We will go through and make sure to send off the copy of this later on if you choose to read that. I want to talk just for a few minutes, if my screen will let me. There we go. I want to talk just for a few minutes. For today's session, what are we really focusing on? What vaccines are we really focusing on this season? Flu, COVID, RSV, Prevnar. Obviously, depending on the patient there, what they need or what their needs are, what their plan allows. If you have other payers and/or other vaccines that you would like to submit through DocStation's bin, we can, of course, help with that. We just need to know in advance what other vaccines beyond this list that you do intend to bill through DocStation's bin. DocStation is responsible for updating, any pricing that updates quarterly, annually, things like that with different vaccines. We do update that on our side. So when the claim is billed, it does reflect any new pricing that is posted by CMS. So we do update that on our side on those claims for you as well. Which payers? Now, of course, today, big payer that we are focusing on would be Medicare Part B. I'm personally located in Texas, so is actually, so are all three of us. Malia and Lauren, we're all located in Texas, but of course we do have many other payers, Medicare regions, things like that. So we're looking at primarily Med Part B for that product and administration fee. Now, I know, of course, there are Med Advantage plans and some commercial plans that also allow, and state Medicaid plans, of course, but they also allow you to bill to the medical benefit for that product and administration fee. So if you do have that option available, of course, you can bill those straight as a medical claim through DocStation as well. The other option here that I did mention, or I want to mention just for a couple of minutes, would be adding on a consultation if applicable. Now, of course, you cannot do a consultation claim for a Medicare patient. Medicare will not reimburse that. However, if you do have the option to provide consultation in addition to the vaccine that you're administering at the same time, if you do have the option to counsel that patient on something additional, you are able to bill or attempt to bill for a consultation for that patient. Again, this is non-Medicare, but want to keep that in mind. If you do have the option to do that, you can, of course, add that on to the claim and bill it through DocStation as well. No need to go to a different portal. You don't have to go to a different access. You can do that all through DocStation, and it will still show up on your portal or on your dashboard in DocStation. All right, so before I kind of hand this over to Lauren for a few minutes to talk through her experience as well, I wanted to talk to you a little bit about how this process works. Now, this isn't anything super in-depth. We are going to give you the option. If you're interested, please let us know so that we can walk you through this process in more detail. But I did want to take you through, how does this work on DocStation? What does this look like, logistics-wise? So if you haven't yet already, you would update your DocStation subscription to include bin billing. Some of you guys on here today don't have that on your subscription, and that's okay. So we would update that in that conversation and make sure that you guys are included in bin billing here with DocStation. We also would highly suggest you submit a request for an ERA for your health plan. Again, the ERA is extremely important as far as tracking your claims. And that's what we want to make sure that we have for you as well, to make sure that those claims are going through to insurance, and then we can track those for you on your dashboard. Once we have that ERA request, and in particular for Medicare, Medicare does require those ERAs to be authorized before you're allowed to submit those electronic claims. So once we have that authorized ERA, then your claims are able to go through. We also need a couple of extra steps to be set up in your pharmacy dispensing software, which we provide those steps for you. So we'll walk you through what those steps include, adding a third-party insurance, and of course, using DocStation's bin. There is a 4-digit PCN tied to your specific payer. So if you have Texas Medicare, for an example, we would provide you with that 4-digit PCN that you would, of course, then include into your pharmacy dispensing software as well. Once those are set up, both in DocStation and in your dispensing software, you're ready to start submitting to DocStation's bin. At that point, it would be an easy transition if it's something that you're used to previously, billing to a bin. This is the same setup, it's the same process. Again, I think the biggest difference and the biggest thing that you're going to find with DocStation is that transparency there. So you're ready to start submitting to that DocStation Medicare, whatever you want to call it in your dispensing software, but you're ready to start billing and submitting claims through DocStation. So, with all that said, I would like to take a step back. And we did ask Lauren from ReNue Apothecary. ReNue is based out of the Dallas Fort Worth, Texas area. They have quite a few locations. I've personally worked with Lauren for, gosh, I think maybe close to 2 years now. And I really wanted to invite Lauren onto today's session to talk more about her experience and DocStation and ReNue have been working together since we first launched bin billing. And so ReNue Apothecary was really one of our first sites that launched bin billing with DocStation for vaccines. And I would really like Lauren to be able to share her experience and everything that, kind of changed the game for them as well. So with that said, Lauren, I'm going to hand the mic over to you for a few minutes and let you tell us a little bit about your experience.
Sure. Thank you, Rachel and DocStation, for allowing us to share our experience today. Like many of you, we've been vaccine billing for quite some time, but along the path, there have been several challenges along the way. DocStation helped to solve several of those challenges for us. And so today I'd like to share with everyone a little bit about what those challenges were in the past and how DocStation has helped to remedy those. In the past, we had limited visibility to see claim status. Multiple platforms had to be used in order to complete claim research if we wanted to know the status of a claim, even whether a patient was eligible with the cards or the insurance plans that they provided, as well as claim status and even reporting. A lot of that reporting wasn't available to us from previous vendors that we've used in the past. That made upkeep and reconciliation on our end very time consuming and very cumbersome. And so we weren't able to get a lot of the information that was needed to help grow our business on the vaccine side, as well as medical billing. The loss of the claim visibility resulted in loss of revenue on our side and even inventory spend as corrections or resubmissions couldn't be made in a timely manner. Unfortunately, with the vaccines, we're having to purchase them up front and then we're providing the service to the patient. And without visibility into those claims and what was happening or even the status, unfortunately, at times we were losing on the vaccine product inventory that we were purchasing. Additionally, another one of the challenges that we experienced was that inconsistent methods of communication. We were being told, you can call our support desk or you can send us an email. But unfortunately, we weren't being provided with our previous vendor consistent feedback or communication about the status of our claims, or even when we had a specific question about a payer or an ERA, EFT, anything of the sort, we weren't getting consistent communication. We have since, with enrolling with DocStation, we've been able to remedy all of these things. We have consistent transparency of claim status. We're able to see on a regular basis at any given time, we can log into the portal and we can see the status of a specific claim or multiple claims for a patient. We can tell if it's been paid, if it's been processed, if it's been submitted, or exactly what status with the payer that claim is in. Additionally, that bin PCN billing that DocStation has set up has allowed the same workflow process to be followed in our everyday operations. So it wasn't a big undertaking to train our staff on the process or what needed to be done. It was a very quick and easy process where we added the bin and PCN into our pharmacy operating system, went through a couple of test claims with the DocStation team, and were able to tell our team, we've added the plan to your program. You can begin billing immediately. Additionally, on our side in Texas, we can bill, pharmacists are recognized as providers, so we can bill for additional consultation services. Again, with that same process of just billing through our pharmacy operating system, we were able to have automated templates created with DocStation, and that has resulted in increased revenue with our business as well. As Rachel mentioned, the support team is always great. shout out to Malia and the team and Rachel, everyone over at DocStation. They have been a great support. With any question that we may have, we can reach out to them not only by email, but via the chat feature that is available in the portal, as well as if we have specific questions on a claim, there's dedicated claim assistance just by going into that claim and being able to ask anything that we may need to know. Additionally, the support team helped us with our ERA setup and getting all of that completed in a timely manner, making sure that we didn't miss any payments, making sure that we always had access to our claim statuses as we were going through that transition from our previous vendor. So it's been great working with DocStation in the time that we have been with them. And overall, our business has seen great success and an increase in revenue. Along with that increased visibility into our medically billed vaccines, and we're excited to see what's next.
Thank you, Lauren. That was great. I do appreciate all of the shout outs. I know that, working with you guys over the last couple of years, especially when DocStation first launched, been billing for vaccines, having a partner like ReNue to be able to go through testing, to be able to go through and really make this product what it is today has been extremely beneficial. And I know that if Aubrey, our product manager, was on here, I think she's in the audience somewhere, but I know that having partners like ReNue, and we do have several others that we've partnered with as well to kind of test new features out. This has been extremely beneficial for both parties to make sure that, the product is what it is today. And of course, we want to continue to make it better and continue to iterate. So, we really do appreciate all the partnership on our side as well. So to continue the conversation a little bit, I can get my screen to cooperate. Sorry about that, guys. I would like to talk a little bit more about some different types of opportunities that DocStation does offer in addition to bin billing for vaccines. I know that's the big focus of today's session, but we do also offer the ability to bill any other type of medical claim, including E&M codes. So several of you guys on here today are in states that do have provider status, whether that is through your state Medicaid programs, commercial payers, etc. So we do have the ability to help you bill for those evaluation and management or preventative consult claims. We also do have DME capabilities as well, in addition to MTM. So for those of you that are online with different states that do offer MTM programs through either your MCOs or a couple of different commercial payers, we can help you with documentation for medication therapy management or CMRs, in addition to billing for those. And of course, DSME as well. So DSME is becoming more and more popular as an option to be able to bill to Medicare as well. Now, DSME, just wanted to make sure I state it does require additional certification. So keep that one in mind as well. But any of these services and a few more, of course, you can bill through DocStation as a medical claim, in addition to using DocStation's bin. All right, so we are at the half-hour mark, so I'm going to talk just for a few more minutes, and then we will open this up to some Q&A opportunities as well. So if you have popped any questions into the Q&A, and again, unfortunately, as the presenter right now, I can't see those as they come in, but if you do have some questions, be sure to pop those into that Q&A section on Zoom, and then we'll be able to address those questions for you as well. But before we get to our Q&A, I do want to be transparent and make sure I go through with you the cost of DocStation or of adding bin billing onto your platform. So our current subscription pricing is $239 a month for the subscription, for the monthly subscription, plus $2 per bin billed claim. And that is per doesn't matter what type of vaccine you're billing, just $2 per bin billed claim, and then 10% of anything paid as a non-bin billed claim. So that's applying to evaluation and management, DSME, etc. However, if you do decide to sign up before July 31st, before the end of this month, we are offering 10% off of your monthly subscription for an entire year. So those of you that are online today and then get that follow-up email from DocStation, please make sure if you would like to capitalize on that 10% off, please let us know so that we can apply that to your subscription before the end of the month. We do have a form to be able to capture your information, and we will send that out after today's session. So if you are interested in an additional phone call or some additional information, or if you're just ready to go, you can fill out that additional form for us, give us that information, and we will get you all set up and ready to go. Let us know if you would prefer an email as a support, or if you would prefer a direct phone call, or even a one-on-one Zoom if you need that as well. We can certainly set something up for you. But you'll receive that email notification after this call today. We will grab all the attendees from this session and then make sure to send you out the form to capture your information today. Included in that email will be a copy of this recording and the PDF version of this deck here today, so that you can go back and review anything that you need to as well. All right, so again, we're kind of at that 35-ish minute mark, and we've got about 10 minutes or so left in today's session, 10 to 15 minutes. So I do want to make sure that we have enough time to be able to answer any other additional questions that have come through. So give me 1 second so I can make sure to grab those, or if Malia, if you have any that you would like to make sure that I address here today as well, I'm happy to do that.
Yeah, I can. Do you prefer just read them out, or?
So these, yeah, the Q&As are not posted live, or they don't show to everybody. So yes, it would be super helpful to ask those out loud.
Okay, so first question, can we bill MCOs medical for vaccines via DocStation?
Yes, is the short answer. So MCOs for medical, or, for vaccines, yes, you absolutely can. As long as those are going through to the medical benefit, yes, DocStation can help with that. If you are planning to bill, the product and admin, you can use DocStation's bin to set that up the exact same way, even if it's, it's to an MCO, as long as they do allow those claims to be billed on the medical benefit. I know there are a few that have some limitations, of course, but as long as your state does allow those vaccines to go through on the medical benefit, you can absolutely do that through DocStation as well.
Okay, next question. Do we have availability for service in Arizona?
So yes, the short answer. So for billing to DocStation's bin for Medicare Part B, obviously, as long as you are registered as a provider for Medicare, you have to have a PTAN, either a mass immunizer or a pharmacy PTAN, to be able to bill to Medicare for services. Now that includes, your vaccines. So the list of vaccines that I supplied. But the other clinical service that you might be interested in would be DSME or the diabetic self-monitoring courses. But short answer is yes, we can bin billing set up that in Arizona as well.
Thank you for that. All right, and then we have questions on consultations in New York.
Yeah. So we do operate in New York. Right now, I have several clients in New York. Their big focus right now in New York would be DSME, or those diabetic self-monitoring courses there. And whether that's submitting to an MCO in the state. I think I saw some of my folks on here from New York, and I think they would probably echo this. Some MCOs are more challenging than others, but we can submit DSME. We can submit, of course, been billed to Medicare Part B for those vaccine claims. Consultations, to be honest, have been hit or miss. So I do have some folks that are trying to bill consultations for, a visit from a patient, things like that. But oftentimes you'll find that you have to bill as an out-of-network provider. So in some states, of course, it is challenging. It is difficult for major payers, and they just are not allowing pharmacy in network as a provider. And so it has been challenging as far as consultations go, but there are services that are either mandated like DSME, or of course your Medicare Part B vaccines. So hopefully that helped answer that question a little bit better.
Thank you so much. All right, next question. Can we do DME rental billing?
Short answer is yes. Longer answer for DME through DocStation. I want to be transparent and say, DocStation is trying to be, a catch-all where we want to be that platform that you can do everything in. But I do want to be sure to be clear on, the capabilities for DME billing and DocStation. What you would do for DME billing is you would create a template for whatever product you are looking to bill. And then as far as designating whether it's a rental or not, that is a modifier that you can add directly onto the claim to indicate back to the payer that it is a rental. But short answer is yes, you can absolutely bill DME products through DocStation that are going out as a medical claim, whether they're a rental or a new product.
Wonderful. Thank you.
Mhm.
Next question. So for the bin billed claims, there's no 10% fee, just the $2 bin billed claim.
That's correct. Yes. So DocStation can see the difference between whether or not a claim was billed to DocStation's bin, or if you just created a clinical claim as a medical claim on DocStation. So anything that's billed to our bin is just a flat $2.
Wonderful. All right, here's a good question. Is there a higher reimbursement through DocStation? Why should we try medical billing in the pharmacy?
That's a fantastic question. And I really think it depends on what you look at for a particular payer. What I tried to highlight in this presentation is the benefit in particular for Medicare Part B is going to be the transparency that DocStation offers. Reimbursement through Medicare, CMS sets those rates, right? They're not going to change significantly anywhere you go. However, the benefits that you will get through DocStation for your Medicare Part B vaccines absolutely would have to do with the transparency, the tracking of those claims, the reconciliation. Now, beyond Medicare, right? So we always want to see what other opportunities are out there. And without knowing necessarily what state you're located in for that particular question, looking at your state provider options. So if you have, for example, in North Carolina, right? So in North Carolina, you have the opportunity for state Medicaid allows pharmacies to apply as a provider. So you can submit a lot of different types of claims for additional reimbursement. So if you're looking at a commercial or a Medicaid or, sometimes a Med Advantage plan, you do have the opportunity to try to bill for an additional consultation. So that additional time that you spend with that patient for really any consult, for any visit that you have with that patient, DocStation would encourage you to try to bill for that time and try to capture that additional revenue. And I think that's a little bit of what Lauren tried to speak to as well. As if you do have the opportunity and you counsel that patient on additional topics, try to bill for your time and get reimbursed for it. Now, again, depending on your state and depending on your provider options in your state, it might be a limitation there, but we would always encourage you to try.
Thank you so much. And then our last question we have, pretty long one. Let me get to this one. Okay, when it comes to billing vaccines, in terms of best practice in maximizing profitability, what does DocStation recommend? Billing vaccine consultations for Advantage and commercial plans, and continue to bill the vaccine and administration itself through the pharmacy side, or keeping it all on the medical side?
Great question. So if you have a payer that does allow billing on the medical benefit, I would highly suggest you to bill as a medical claim. The reimbursement opportunity would potentially be higher as the medical claim. Now, there are particular payers that do not allow the pharmacy to submit on the medical benefit. So I'm thinking there are some particular plans, and to be clear, it really does depend on whether or not that plan allows the pharmacy to submit a medical claim. There are some that are going to kick it back and say, no, this needs to be on the PBM side, and they force you to go through the PBM. However, if you do have the option to submit everything as a medical, the product, the admin, and if you did provide counseling on a particular topic, absolutely go through it for the medical benefit. That's how you can capture additional revenue. When you bill that particular product and admin, on the DocStation platform, you have the ability to set the price that you would like to bill. So I do know that there are particular payers where, we have some states and some pharmacies that are billing directly to the medical benefit for a vaccine, and they are getting higher reimbursements than if they would have through the pharmacy benefit. But again, it would depend on the particular payer. But as far as best practices go, one, knowing who those payers are that would accept that as a medical claim. But, at the end of the day, we would want to make sure one way or another you get compensated for that product. And if you are able to submit to the medical benefit, absolutely go for it.
Okay, question in, let's see. For Minnesota, does the provider need to be credentialed with the plan to bill a vaccine through a medical claim
Ooh.
with the recent changes in Minnesota?
Good question. So I do believe recent changes in Minnesota will go into effect in 2025, January of 2025, I do believe. And I think we have several people on this call from Minnesota. And from what I have learned through payers in Minnesota, I think they are still also working through what the options are to bill on the medical benefit. As far as what's required for credentialing, I'm actually researching that at the moment as well, in addition to a couple other networks that are working particularly in Minnesota to try to figure that part out. There are a few plans, a lot of Minnesota is dominated right by your MCOs, but there are a couple that I'm aware of that you could bill the vaccine to the medical benefit. But again, as far as the changes that are coming in 2025, I do believe that's going to require some additional research. And I don't know that I'm the best person right now to provide what that would look like. But I would definitely want to make sure that we get the right information back to you guys. We do have a lot of folks in Minnesota, whether or not you guys are on this call, but just in general, DocStation does have quite a few clients in Minnesota. So once we know what those opportunities are, you can bet we're going to share those opportunities as well.
Right. And we had the same question about Illinois. Does pharmacists need to be credentialed to bill the medical benefit?
Yeah, so in Illinois, I do actually believe you have the opportunity to do so through the state Medicaid. So I would explore that option if you are not already as a provider through your state Medicaid. Start there is what I would suggest. But I do believe you have the option to enroll as a provider through Medicaid in Illinois. But yes, that would be something I would suggest looking into.
Okay, now we do have a few more questions, but I know we're already at time, so I want to be respectful to everyone's time and say thank you for those that have joined us. We will be following up with an email as well as a sign-up form. Let us know. Were you able to get information from this? If you have further questions, happy to help answer any questions that do pop up. But I will go ahead and close out the questions, the Q&A. For those that we did not get to, I will go ahead and email you personally with a response. So be on the lookout for that.
Perfect. Well, thank you all so much. Again, it was fantastic seeing a lot of familiar names at the beginning. For those of you that joined in, I really do appreciate that. Of course, as always, please reach out, use that support option down at the bottom. We really do appreciate all the feedback that you guys give. It is extremely important. If you have any questions about today, please feel free to reach out. But again, please know you'll get a follow-up email after today. It will include the recording. It will include a copy of the slides that we went through today, in addition to a form if you are interested in signing up with bin billing through DocStation so that we can capture that information for you. So once again, I really do appreciate everybody's time and attention today. And if we didn't get to you in the Q&A section, you're more than welcome as this session ends, drop in some more questions so that we can email those out to you, or just drop them in the chat support option in DocStation, and we're more than happy to help out. All right. Well, thanks everybody so much for attending. We really, again, do appreciate it. We're going to go ahead and close out this session again today, just to be respectful of everybody's time. If you do need us, you know where to find us. Thank you so much, guys.